everyone's going to see a slightly different patient base by who you attract. But the patients or the parents that I work with, they say, you know, now that we think about it, they were the one that didn't get the perfect attendance record at school. You know, they were the one that kind of sort of had stuff going on, skin rashes or something like that. So they're fine in air quotes, meaning they're limping along and showing up, but not to their best, you know, strength. And then they get something. So it could be an infection, and rarely it could be only the toxin exposure. But the toxin exposure is laid on top of that immune deficiency, and it may actually be the cause for immune deficiency, as in the case of mold. And then, you know, this infection starts. So the most common symptoms, and for if we lump them all together, anxiety is a huge one, and separation anxiety is the most common way that that anxiety shows up. And that could be to a parent, or that could be to a room, a space, and often is a little bit of both. So they have trouble, you know, either leaving the parent, or they have trouble leaving home, maybe, you know, school refusal, those sorts of things. Difficult concentration. So it can sort of look like a kid who, if there's anxiety, you know, and they push through and you can get them to school, and then they can't concentrate when they're there. So they may get first called ADD, but anxiety type, in air quotes again, anxiety type ADD, because they had the anxiety about leaving home and then, you know, couldn't pay attention at school. And what's really curious about all of them is that we really focus on the damage to the brain, but we see urinary frequency as one of the most common symptoms across all of them. Now we see that with mold too. So I'm curious, once we get to do some really deep studies, how many of those kids actually have mold as the core. My top 4 bad guys, environmental bad guys for causing or contributing to these conditions is weed killer, also known as glyphosate or Roundup. Horrible on the gut. And we can talk about why the gut matters for autoimmune. And then mold, and then EMFs and mercury. And that just has to do with, all of those have to do with the gut-brain connection, and then their ability to affect the brain and the immune system of the brain. So we can see tics, we can see obsessive compulsive disorder, we can see kind of a classic one that we'll hear from parents is that they went to school, or their handwriting is completely off. Like it looked normal, and then there was something that they might have a drift on the page where they're starting farther over to the right, and the handwriting is just a mess. Or maybe in art, they're not able to do symmetry. So there are these things that some of the fellow PANDAS PANS parents that I'm friends with are school nurses. And I feel like these ladies, not all these, my friends are ladies, but ladies and gentlemen, are one of the most important first, I don't know, exposures or whatever. We need to be educating them, because they will be the first ones to see this. You know, learning difficulties, handwriting, loss of symmetry in art, you know, wow, they could really help identify this and help get kids treated a lot sooner.
Yeah. And what about like the OCD aspect?
So you will see on the clinical criteria, so both of these conditions, PANDAS and PANS, are diagnosed by clinical presentation. So you don't have to have any particular lab that says, yes, for sure, this is what you have, unless you're